What is professionalism? And doctors, we're a profession. Hospitals are an association. Industry is, in our country, market-driven and profit-driven.
Today's discussion is part of our thought leadership series From Silo to Synergy, Redefining Healthcare Research Ecosystems. Today, we are honored to be joined by Dr. Robert T. Grant, Senior Clinical Associate Dean at St. George's University School of Medicine and former Plastic Surgeon-in-Chief at NewYork Presbyterian Hospital, Columbia, and Weill Cornell Medical Centers. Whether you feel that current research models sufficiently integrate the realities of clinical practice into study design and interpretation.
This is a great question because as a clinician, people have multiple loyalties. They have loyalty to their own practice. They have loyalty if they're a member of university practice. They have a loyalty to the organization, loyalty to the healthcare system. And then, of course, industry has a role too, because industry looks to be the place that can really continue most reliably to fund these kind of projects, so that when you're making your budget for the year, it's nice to know that no one's going to pull the rug out from you sort of inadvertently based upon who you voted for or not. So that's very important too. So having the ability of those disparate groups, individuals, organizations, professional groups, universities, and industry to come together to agree who is really going to be at the final hour making the ultimate decision, that's a management decision. And I think that's where my feeling is that a consortium approach where everyone agrees to have a seat at the table, and whether they rotate that final decision or they have a structure within their bylaws to decide is probably for larger scale types of research projects, the way that successful ones are going to have to be designed to be successful moving forward.
How do you see healthcare research evolving in terms of collaboration and stakeholder engagement?
The first aspect to understand is that it really requires a fairly well-structured and organized framework for it to be done and done well, which really means that it has to be organizationally based. There has to be a central core, which really is going to be able to meet the logistic, regulatory, and bookkeeping type of aspects that are associated. So individual practitioners and clinicians are going to have real challenges in terms of participating in research moving forward. If their medical records become electronic, that perhaps is a way that they can become involved. But I think the processes which we've seen over the past few decades, where centrally, whether it's by an academic health center or a consortium of health centers or by industry, is going to continue to dominate how research is done.
In your view, what drives or erodes trust in healthcare research today?
What is professionalism? And doctors, we're a profession. Hospitals are an association. Industry is, in our country, market-driven and profit-driven. And those are three very different perspectives when, you have that as your underlying philosophy. Coming up with creative ways, philosophies to unite those particular different foundational backgrounds of the different folks. And a lot of that just comes from communication and talking about it at first and making sure that you're not assuming that someone's coming to the table with the perspective that they may or may not actually be wanting to talk about.
What does synergy mean to you in the future of healthcare research?
To me, that's what synergy is: more communication, more transparency. When it comes to industry's involvement, it's all about NDAs and not letting anybody know what we're doing and not having anybody steal our ideas, because we put this idea out there and someone's going to figure out how to do it for 10% less. And then what's called the innovator's dilemma. You come up with an idea in America, in 2025, the research aspect of it touches on many of the same problems that have to do with equitable healthcare delivery. Is it a right or a privilege? Many philosophical questions, which to date, our system, as bad as it is, works well enough that no one's willing to throw it away. And, we're seeing these last vestiges of Obamacare being eviscerated by, what's happening in Washington because it didn't live up to its potential. And people are saying, well, use the government shutdown to blow it all up and start over.
Thank you so much for all of those insights. Extraordinarily helpful, and will certainly help to mold the future of research.